Hello and welcome. My name is Chris from christopherhall.com. Welcome to this video where we're going to be talking about injuries and overviewing what they are, different types of injuries, and some tissues that are involved in the injuries. So in this first slide, we're just going to be talking about the three different types of injury from a very broad and general perspective. We're not talking that there are only three injuries that happen to the body. There are many injuries that happen to the body, but they can be categorized in three different areas, if you will. Category number one is a traumatic injury. Category number two is a pathological injury, and category three is a non-specific injury, which we'll expand on a little bit more because there is a bit of a grey area with non-specific type of injuries. But if we start with traumatic injuries, these are the injuries that happen in one event, if you will. So it's the spraining of an ankle. So you jump off a wall, you land on the floor, and you turn your ankle. That would be described as a traumatic injury, or a leg break, or a ligament tear in your knee, for example. Those three types of injuries would be known as a traumatic injury. It's one event where tissues rip, tear, strain, whatever it may be, in that one event. Then we come on to pathological. Now again, these types of injuries are sort of caused by another type of illness or injury. So on a very extreme level, people with cancer can then that cancer can then cause a lower back pain, for example. So it's a type of injury that is caused from another injury or illness. So it's a pathological injury. Then we come on to non-specific injuries, and non-specific injuries are these, or are quoted in here. There are sort of grey areas around it. An easy way to describe it is non-specific injuries are the straw that broke the camel's back. So about 19 out of 20 cases of acute low back pain are classified as non-specific, which basically means the other one of those 20 are split in half between traumatic and pathological. So you can see that only 4% of all of low back pain are traumatic and pathological, which is where non-specific gets a lot of its grey area. So to describe what non-specific injuries are, certainly in the back anyway, non-specific low back pain is defined as low back pain that is not attributed to a recognizable known specific pathology. So what that basically means is these two here, when you jumped off that wall, that caused that injury. Or they can understand that low back pain can be caused by another pathology, for example, cancer. With non-specific, it's not attributed to anything specific, if you will. There are certain markers that we can test and understand, but it's not anything that's very simply defined as per the other two. So one way of understanding what causes non-specific low back pain is repeated subfailure loads lead to tissue fatigue, reducing the failure tolerance, leading to failure. So non-specific injury or low back pain, now it can be broadened out because they do understand in Achilles tendon ruptures that there are micro tears within the tendon, and then all of a sudden the injury, the traumatic injury that causes a lot of pain happens. So it's not necessarily the one thing that leads to an Achilles rupture. It could be, but there are also markers that lead up to it, and it's these little repeated subfailure loads. So they're just little mild injuries or micro injuries, as I like to call them, and then eventually that turns itself into a major injury, if that makes sense. So these are the three sort of types of injury that are about. What we're going to look at in the next slide are the different tissues that are involved in these injuries, and we're going to talk a little bit about rehabilitation and how to overcome these types of injuries.